What's up, Z-Pack? It's your boy Z-Dog-MD, aka Dr. Zubin Nemanja. This is Z-Pup Prime. She just got a haircut, so she's, enjoying her silky smooth short hair and rubbing it in that I have no silky smooth short hair.
It's just stumpy and scratchy.
The way I like it. Anyway, so I wanted to talk a bit. I'm in my bathroom because it's Sunday night and,
I'm gonna ditch you now.
You're going to ditch me? Bye, sweetie.
Because you're boring.
You're boring.
You're even boring.
And stay out. Anyway, so I wanted to talk about an interesting phenomenon that happened tonight. What happens when you're a doctor or a nurse or an RT or a, dietitian or what have you, or you're a weirdo and you have a kid who has something funky and you're trying to figure out what it is, but it's not in your specialty. What happens when doctors consult Dr. Google? So we talk about patients doing it all the time, and many times in a derogatory way. Wow, you're going to think you have cancer, even though you have this mild symptom. Suddenly, you're dying of AIDS, and that's the danger with the muggle or non-medical person using Dr. Google. You don't have the training or the context to know how to even start or frame the search. And you can get pulled in a million different directions, many of which are false leads, can lead to a lot of anxiety and ultimately either delayed real diagnosis or incorrect diagnosis. And a lot of times when patients make the diagnosis using Dr. Google, there's been some study on this, they often get it wrong. I think it's like a crapshoot, depending on obviously what you're doing. So Michelle Phillips says, I consult up to date. As do I, but let me tell you how this went down and what happened. Okay, so Z-Pup Junior, the youngest Z-Pup, she's 6.5, almost going on 7 now. She, over the last couple weeks, I'd noticed a sort of a dark, patchy, rough rash on her neck. Now remember, it's spring in Vegas, it's spring around the country, but it doesn't feel like it, does it? So there's been a lot of sun exposure and other stuff, so I thought, could she have a sunburn? It wasn't that. Could it be atopic dermatitis, like an eczema sort of thing? It wasn't itchy. It wasn't peely. It was a dark sort of plaque-like leathery rash. And so I showed it to Mrs. Dog, who's a radiologist. Now, I'm a hospitalist for adults. She's a radiologist. Neither one of us really deal with rashes, except for I deal with stuff in the hospital, which is often like drug eruptions, things like that. Or like Stevens-Johnson's or something severe like that. And she doesn't do rashes, but she's visual, obviously, because she's a radiologist. So how do we go about figuring out what's going on? The first thing that happens is we see this rash. And by the way, it looked something like this. This is not her rash, but this is what it looked like. So these patchy brown plaques. And they were rough. And they weren't bothering her in any way except visually. And she's one of those like smarty pants, high anxiety kids that we talked about with Dr. Blair Duddy, a little bit gifted, but also a little neurotic and worried about stuff, kind of like dad, except for the gifted part. And so we were trying to figure out, so my wife saw it and Mrs. Dog saw it and she goes, what is this? Okay. So the first thing we do is we start coming up with a differential. Is it eczema? Well, it doesn't itch. It's not peely. It'd be a little odd. She's never had it before, but it's possible. Could it be, and the first thing I thought when I saw it is it looks like acanthosis nigricans, which is something we see in adult medicine. You'll see it in children, in obese patients, patients with insulin resistance, patients with polycystic ovary disease, patients with certain rare paraneoplastic syndromes where you can have a cancer and it can present with that. So of course we're like going through the differential going, acanthosis nigricans, why would she have acanthosis? She's skinny, there's no evidence of diabetes, there's no reason to think she has insulin resistance, and it's in the front, most often it's in the sort of the folds in the back, but it can be in different places. So using that, now we're both obviously trained medical people. So how does that inform how we search? Well, first of all, we know the terminology to search. So we go, okay, it's dark, so we're going to use the term hyperpigmented. And I went into up to date, which is we did parallel searches at the dinner table after dinner. So the kids are playing and we're like, let's figure out what this is, because I don't want to see a dermatologist in Las Vegas because I just don't. And I don't want to bother my friends with this, my pediatrician friends, and I don't want to bother my derm friends. Let's see if we can figure it out. If we can't, we'll take her to see someone. And this is typical medical parents, right? Because we often won't take our kids in if we can avoid it. And sometimes that's good and sometimes it's bad. Both my parents never took me to the doctor. They're both doctors. And man, I tell you, I mean, I had some close calls with death before they would ever take me in. So that's just a function of being a medical kid. So all that being said, this is what the thing looks like, right? So I think acanthosis, I'm searching acanthosis nigricans in UpToDate, which is the software that we use that is a peer-reviewed clinical database. She goes in and does a parallel search using Dr. Google. Now, in UpToDate, I'm starting with acanthosis hyperpigmented macular rash in children. And there's a big differential that comes up. A lot of interesting stuff. None of it seemed entirely to fit. There was one thought that kind of came close, which is a kind of a cutaneous hamartoma syndrome. I forget the exact name of it. And so she's searching, same thing, pulls up acanthosis nigricans as a hyperpigmented rash, digs into that, finds a paper, says, it really doesn't feel like acanthosis. She has no reason to have that. So looks at in one of these, it was in Consultant 360 or something else, one of these websites, there was a differential diagnosis for acanthosis nigricans. Now, for those people who aren't medical, differential diagnosis simply means what are the different things it could be that could look like acanthosis, which was our sort of starting point just because it snapped to us from medical school, dark pigmented rash and stuff I see in the hospital. Well, one of the things on the differential was a syndrome called firma-forme dermatosis. Let me see if I can flip this. Hold on, because if I can make this less mirror imagey. There we go. Firma-forme dermatosis. So in consultant360.com, and that's a sort of a medical site. So firma-forme dermatosis, my wife is Googling through, and she sees this thing, and she says, holy smokes, reads the case. 13-year-old Caucasian female with a rash on her neck for 3 weeks in duration. Our little 6-year-old, 2 weeks in duration rash. She was asymptomatic, but complained that cleaning her skin with soap and hot water did not lead to improvement of the rash. Same with our daughter. She'd scrubbed it, she'd soaped it, it never came off. It wasn't dirt. So the patient had no medical conditions, etc. So already it's starting to fit. Physical exam of the girl revealed a hyperpigmented patch on her anterior left neck. See the figure. And there it is. And we're like, that looks really familiar. And here you go. So she got a diagnosis of firma-forme dermatosis. And the way you test this is you wipe the skin with 70% isopropyl rubbing alcohol, and the rash comes off. So I'd never heard of this, obviously. I'm a hospitalist. It's not something that's ever come up in my experience. And it turns out, you read more, TFFD, firma-forme dermatosis, is a benign disorder of keratinization, that's skin formation with keratin, that affects children and young adults. The most prominent clinical presentation is a brown-gray, velvety, pigmented patches or plaques that resemble dirt. Bingo. In children, it presents on the neck, but it can also be in other places. Patients typically present during spring or summer after sun exposure. Bingo. Parents complain of a brown, dirty rash that cannot be washed off with normal soap or routine cleansers. The etiology, the cause of it, is unknown, but it is not due to a lack of personal hygiene. Let's just quit complaining about my kids' hygiene, which means our hygiene. Speculations into the etiology suggest that it is a dermatologic disorder of abnormal and delayed keratinization, causing altered maturation of keratinocytes and retention of melanin. Who cares? Basically, it means abnormal pigment deposit and keratinization formation. So that being said, the way that you both diagnose and treat this is you rub it with rubbing alcohol. So of course I grab the rubbing alcohol and I start rubbing on it. We're all laughing, thinking this is a joke, it's not gonna work. The rash wipes off. And then we did the entire rash and it was gone. So the diagnostic tool of alcohol rub showed the diagnosis, and it is also the therapeutic tool of removing the rash. So let me summarize this amazing experience because it kind of blew my mind. If I were a patient and was not educated in medicine, I might have jumped to all kinds of conclusions about what my child had. I would have gone right to the dermatologist, which is appropriate, and they would have found out hopefully what I actually had. But I would have induced a lot of panic, worry, and nervousness before I figured out what actually happened. The way doctors, and it took even two of us to use Dr. Google because I didn't immediately find it in UpToDate. It didn't show up. So she had to Google in the regular pantheon of the universe, avoiding the WebMDs and other things like that, and going for sources that she felt were more trustworthy. And using our medical deduction, we were able to go down a path that actually diagnosed the thing. Neither one of us are dermatologists. So it illustrates a point. Dr. Google, in the correct hands, in other words, in trained hands, can be potentially beneficial. It can still be dangerous because we don't know what we don't know as dermatologists. It's a sort of a Dunning-Kruger effect, right? So ultimately, we may have had to take her to the dermatologist. But it kind of illustrates that the seas of Dr. Google are very turbulent and very dangerous for the uninitiated. And even two highly trained physicians kind of barely got the diagnosis right, working together. And actually, it wasn't the medical text that helped me get it. It was my wife's direct Google search. So really fascinating. Let's read some comments here. If I can make this go away. I have no idea how to do it. There we go. That's an old ED trick too. Alcohol swab at Cynthia Griffin. Right. I've never used that. It's amazing. Let's see. Hi, I just had 8 hours of Dr. Google at my nursing call center. There you go. Nice use of Dunning-Kruger effect, says Cassandra. Yeah, it's one of my favorite effects because it's used by anti-vaxxers. It's used by alternative medicine people. They learn a little medical terminology and they suddenly know just enough to be dangerous. And they're not smart enough to know what they don't know because they don't have all the training. Whereas both me and my wife know exactly what we don't know. We're looking at each other going, do we really know what we're doing here? Let's call up so-and-so or so-and-so, all our friends who are dermatologists. And in the end, we just happen to do the right Google search and go down the right path. And again, when doctors go down a Google hole, it's a very different Google hole than when patients do it. And this is very, very important. This is why we really, really, really need to work in partnership with our patients to help curate online experiences, because otherwise, drama, my friends. Any cooking with Z-Dog videos soon? Joshua, maybe. Hey, let's take a walk. So anyways, guys, let me know what you think about the whole Ooh, we're going to be in the dark. Ooh, spooky, spooky. Evening from RUSM. Let me know what you think about the whole, Dr. Google thing, you guys. And also, let me see. You have to have a paid subscription to UpToDate, Sonia Connolly. Yes, or work in it's dark. Or work in an organization that has an institutional subscription. I happen to pay for it because I do a lot of my CME using UpToDate. All right, kitchen with a little bit of light. Let's see. I'm in the veterinary world, and we have clients Googling right in front of us in the exam room. Eye roll emoji, says Mary Z. Yeah. And look, it's important to have our patients be empowered, but it's also important to understand the limits of being able to go through the internet and, quote, do your own research. I hate it when people say that. I did my own research. No, you didn't. You did an uninformed Google search and were led down a path that could be any degree of credibility, and especially low credibility. And that's the problem, is we don't have the time in healthcare now to be partners with our patients to help walk them through it. When we were running Turntable, that was a key thing, is you would sit with them, and if they're going to do a Google search, you sit there with them and go, this is why, no, don't go to this site. Well, this is why this doesn't apply to you. Let's go here. And it takes a lot of experience, not just training, but the actual on-the-ground experience, which is why I think it's very important, whether you're a doctor or a nurse practitioner or a PA, it's the hours and hours and hours of clinical experience that are going to make you really astute and intuitive, and no amount of book training can substitute for that. All right, homies, thanks for joining me on Sunday night. I'm going to turn this into a little episode and put it up. I hope you guys are enjoying what we do here on the show. Please hit like, hit share, leave a comment. Tell me your story about Dr. Google. And if you're a dermatologist, let me know more about this thing, man. Is my child dying? Because WebMD says that she's got, eye cancer. Anyways, I love you guys. We out. Peace.